Blood in stools, most often people think it could be because of piles or hemorrhoids, and they tend to neglect this symptom. But remember, this could be one of the symptoms of ulcerative colitis. Hello, I am Dr. Srilekha, consultant physician on MFine, and today let me tell you about ulcerative colitis, what causes ulcerative colitis flare up, and if there is any ulcerative colitis natural treatment. Ulcerative colitis is one of the types of inflammatory bowel disease, and in the past 2 decades, incidence of ulcerative colitis in India has increased. In ulcerative colitis, colon and rectum part of the large intestine are affected. The lining of the intestine is inflamed for a long time, and it can lead to ulcer formation. What causes ulcerative colitis? Well, the exact cause is not known yet, but there are some potential contributing factors which can trigger or aggravate ulcerative colitis. First is the genetics. Having a positive family history, or if your first degree relative is affected, then your risk of having ulcerative colitis is increased. Recent infections with Salmonella or Campylobacter can also increase the risk. There is a postulation that some of the luminal contents in the intestine, especially the bacterial contents, they leak into the gut wall and they trigger an abnormal immune response which also affects the host tissues. Diet rich in red meat, fats and processed sugars can also increase the risk according to some studies. What are the symptoms of ulcerative colitis? Symptoms usually tend to develop over a period of time, and they include pain abdomen and recurrent attacks of diarrhea or increased frequency of stools. Most often people think that this could be a bacterial infection and they tend to take antibiotics, but even after using the medication there won't be much improvement. There can be symptoms like passage of mucus and blood in stools. Other associated symptoms are tenesmus, meaning painful defecation, and also there is an urge to pass stools, but the patient will find it difficult to pass stools. There can be other symptoms like anemia, weight loss, dehydration. In children, delayed growth and development can be seen. Severe life-threatening symptoms include severe diarrhea, dehydration, severe pain abdomen, including abdominal bloating, tenderness and distension. This could be due to intestinal perforation. Not just the intestinal symptoms, there can be other extra-intestinal symptoms like increased risk of clotting, inflammation of the eye, that is uveitis, inflammation of the joints, that is arthritis, inflammation of the spine, that is ankylosing spondylitis. How is ulcerative colitis diagnosed? This is by biopsy. Usually colonoscopy is done, meaning a small flexible endoscope with camera is passed through anus and small bits of colonic mucosa is taken, and these small bits are examined to confirm the diagnosis. Other tests include complete blood count, ESR, CRP, stool pathogen test, stool fecal protein test, and these tests are done to rule out other conditions. Radiological investigations like X-ray, CT, MRI can also be done to see the extent of inflammation and also to look for complications. So how do we treat ulcerative colitis? The main aim of the treatment is to induce remission and to prevent further relapse or ulcerative colitis flare-up. This includes medical management and surgical management. Medical management includes oral medication and also enema, wherein liquid medicine is given through anus. Most patients respond well to medical management. If there are patients who are presenting with severe symptoms in the initial stages itself, or patients who are not responding to medications well, or if there are any cancerous changes in the intestine, then we go for the surgical management, that is removal of the part of the intestine that is affected. Coming to the ulcerative colitis natural treatment. Unfortunately, there is no natural treatment for ulcerative colitis. You need to use medication, and certain lifestyle changes can actually help in preventing the flare-ups. Do not try any DIY treatments at home thinking it's ulcerative colitis natural treatment. This can instead aggravate the symptoms and cause flare-ups. How to avoid ulcerative colitis flare-ups? Certain diet and lifestyle modifications can help manage the symptoms. There is no evidence that a particular food can cause ulcerative colitis. Certain foods are known to aggravate the symptoms, so try to maintain a food diary. This can help you identify those triggers. And also try avoiding dairy products because they can be a culprit. Stay hydrated. Instead of 3 large meals, try to go for small frequent meals. This can help. Avoid caffeine, alcohol and carbonated drinks. Manage your stress levels because stress can cause flare-ups. Do some yoga or meditation or exercise. This can help in managing stress. Ulcerative colitis symptoms can cause anxiety and distress to a lot of patients. Try seeking a mental health professional's help. I hope this video helped you in understanding ulcerative colitis and what are the treatment options and how to avoid the ulcerative colitis flare-ups. If you are experiencing any of the symptoms mentioned in this video, try to get in touch with a specialist and get yourself evaluated.